What would you say is one of the biggest causes for tooth loss and or decay outside of hormones and or diet? Is there something different?
We focus on something known as the REE Mineralization Protocol. The REE Mineralization Protocol basically focuses on using the mineral hydroxyapatite. So that's our kind of alternative to fluoride.
Okay.
Fluoride has some other side effects that we worry about in terms of like neurotoxins. And so we like to focus on hydroxyapatite, which is a more natural way to remineralize the teeth, because the tooth is actually comprised of calcium hydroxyapatite. So if we can naturally replenish that, whether it be using mineral toothpastes, doing things like minerals, excess minerals in your diet, more supplementation, that really helps in keeping that structural integrity. If we can start that on early and focus on those principles, we can prevent decay, even like preserve gum health, preserve bone density, and that all plays back into like keeping your teeth longer, so.
Is there a brand or a way that somebody can get that form of toothpaste?
Yeah, so hydroxyapatite, there are a lot of good ones out there. A few brands that come to mind like Risewell, Dr. Jen's. There is a great, source of nano hydroxyapatite, especially, which is just a better form that can be absorbed by your tooth.
Smaller.
Yeah, smaller particle. So we see a lot of good results, especially in the carious lesions that we see in between the teeth. So whenever it's still in the enamel, we believe that it can be reversible or remineralized. We don't have to go in there and drill and fill per se. So we can, reverse that and help it kind of grow back, and then just monitor instead of doing a filling, because every time you do a filling, you have a risk of it becoming larger and then, ruining that structural integrity of the tooth. So we want to stop that before it even happens.